Now serving ticket number P9.
Lindrick Holmes has spent most of his 29 years of life in and out of hospitals, waiting.
I was really just surviving or living in anticipation of death.
Holmes suffers from sickle-cell disease, a rare genetic blood disorder that causes pain throughout the entire body.
The pain is bone-crushing.
And here's why. Normal blood cells are round and flexible, but with sickle cell, the cells bend into a sickle-like rigid shape. They pile up, clog vessels, and block blood and oxygen from flowing freely. The result, crippling pain, organ damage, and sometimes premature death.
I was very ashamed of it. I got bullied growing up as a kid. People didn't understand sickle cell, so kids thought that I had AIDS, so they'll pick on me.
You thirsty? You look a little dehydrated in your lips.
The physical and emotional toll built up over the years, until one day, curiosity led Holmes to a twist of fate. He discovered that the National Institutes of Health outside Washington, D.C. was looking for people with sickle cell to participate in a new clinical trial.
I was so low at that time in my life, I was like, I don't care. If you can get rid of sickle cell, I'd rather die trying to be cured than being dead in a hospital or from sickle cell. That's a painful way to die.
Holmes is one of dozens of patients who volunteered for the trial that uses novel gene replacement therapy. Here's how it works. Sickle cells essentially have a defective code. Think of it as a misspelling in their genes. A gene with a normal code without sickle cell is inserted into an HIV virus. The portion that causes infection is disabled.
We have, good 30+ years of research on HIV, so we know a lot about HIV, what it's good for.
And what HIV viruses are good for is transferring DNA into cells, according to Dr. Matthew Shea, one of the NIH doctors working on the trial. The virus containing the normal gene is put into the patient via the patient's own bone marrow. If successful, stem cells will produce healthy cells without the disease.
No complaints.
It's a pioneering alternative to what sickle cell patients are limited to now: bone marrow transplants and blood transfusions. Holmes received the transplant last December and noticed a difference within days.
I felt like I had a little bit more energy once I got it, once they started engrafting into me. And it was new. It was different. It was amazing. It was overwhelming.
You're taking your blood thinner, right?
Holmes makes periodic checkup visits to NIH, and so far, all is going well. He hasn't felt so good in years.
I feel amazing. I feel incredible. I feel ready for the world.
We can't quite call it cure yet, but I would say it's pretty close.
There are still no guarantees, and it could take years to make this therapy widely available. But Holmes is happy to play a different waiting game now, eager for what life has in store.
I can be selfless in a way that I probably never was capable of being. I'm a human. And as long as there's a man on earth that suffers and we're capable of treating or providing any kind of cure or care, we should. We should. We all need that dignity. We all need that respect, no matter what disease you have.
Frances Coe, CGTN, Bethesda, Maryland.